Welcome to the Deep Dive. Today, we're looking into something pretty interesting, a big challenge a major hospital network faced.
Yeah, and how they tackled it using some, well, pretty smart tech. We're talking about Common Spirit Health. Huge system, hospitals all over.
Right, and they worked with a company called Carta Healthcare. We've got this case study that lays it all out.
It really digs into how they revamped their clinical data processes. It started, interestingly enough, back in 2021.
Okay, so what happened?
Well, at one of their hospitals in cardiovascular services, a really experienced senior data abstractor retired.
Okay, that happens. Standard turnover, right?
You'd think so, but it actually kind of exposed some, let's say, weak spots in how they were handling their data abstraction. They were even using an outside vendor for some of it.
Ah, okay, so this wasn't just about replacing one person.
Exactly. It became a trigger, a reason to step back and really look hard at their whole process for clinical data.
What were they hoping to achieve?
They needed things to be faster, more reliable, definitely. And of course, they were looking at saving costs, being more efficient.
Makes sense. So
Yeah.
they probably did some analysis, looked at the return on investment.
They did. And the ROI analysis, well, it basically confirmed their suspicions. The vendor approach they had, super labor intensive.
Took a long time, I imagine.
A long time. Costly, too.
Yeah.
And maybe the biggest thing, the data quality. Not always consistently high. So yeah, they knew they needed to explore other options.
Which leads to the question, how do you actually improve that?
Yeah.
Especially moving beyond those, manual ways of doing things.
And that's where Carta Healthcare came in. Their proposal was interesting. Use advanced AI, like natural language processing, to pull out the key data points.
AI doing the heavy lifting.
Sort of. And this is crucial always with expert human validation, keeping that human review step in place.
So not fully automated, keeping humans in the loop.
Precisely. So they decided, okay, let's test this. They set up a pilot program.
Where did they start?
Just one hospital initially, focused on a specific registry, the Cath CPI registry. And they ran this pilot for 2 years.
2 years. Okay, so they really gave it a thorough test. What did they find? The results must have been significant if we're talking about it now.
Absolutely. I mean, think about healthcare data, getting it right, getting it quickly. It's vital. The pilot showed, first off, a big drop in the costs associated with abstraction.
Okay, cost savings, that's always good. What else?
The speed? This is where it gets really dramatic. Their turnaround time for abstracted data, it went from around 60 days.
60, wow, that's quite a lag.
Yeah, down to just 15 days.
15, okay, that is a huge difference. 4 times faster, basically.
It's massive. Think about what that means for quality reporting, for making timely clinical decisions. Getting that data fast is critical.
And what about the quality? Did the AI plus human approach maintain accuracy?
It actually improved it significantly. They achieved an inter-rater reliability, which is, how consistent different reviewers are.
A measure of accuracy?
Right. Between 98 and 99%. That's exceptionally high. Really shows the combination worked.
So faster and more accurate.
Mm-hmm.
And you said a 75% improvement overall in that abstraction turnaround efficiency.
Yeah, 75%, just a huge efficiency gain. So you look at those results, lower cost, much faster, higher quality.
It's kind of a no-brainer to expand it, right?
Exactly. Common Spirit was, understandably, very impressed. That pilot success wasn't just a fluke. It led them to broaden the partnership with Carta Healthcare quite significantly.
So this wasn't just tweaking things at one hospital anymore.
Oh, no. This became a system-wide initiative. They started rolling this out across their whole network. We're talking over 125 hospitals.
Wow. And presumably applying it to more than just that initial cardiac registry?
Yes, expanding to multiple registries, different types of clinical data across the board.
And the core idea remained that blend of AI and human oversight.
That's the key takeaway from the case study, that combination, the AI doing the initial pass, the heavy lifting, but always having that expert human validation, that human in the loop. That's what made it work so well.
So looking at the big picture, it means faster data, more reliable data, and more cost-effective data management for this really large healthcare system.
Pretty much sums it up. It's a great example of how sometimes a challenge, like a key person retiring,
Yeah, something that seems like a problem initially.
can actually push an organization to innovate and find much better ways of operating.
So just to recap the journey, a staffing challenge kind of opens the door, they explore options, pilot an AI human solution,
Find incredible results in speed, accuracy, costs.
and then scale it up system-wide.
Yeah.
Really shows the power isn't just in the tech, but in how you combine it with human skills.
That synergy is crucial. It wasn't just AI alone or humans alone. It was the combination.
Definitely. It gives you something to think about, doesn't it?
Absolutely. And maybe that's the final thought for you listening. Consider those unexpected bumps in the road, those challenges that pop up in your own work or your field. Could they, like this retirement, actually be an opportunity?
An opportunity to find a totally new, maybe much more efficient or effective way forward.
Exactly. Sometimes those pressures are exactly what you need to spark real innovation, something to mull over.